Joining us today for part 2 in our special series discussing the findings from the recently released study, Young People's Use of E-Cigarettes Across the United Kingdom, is lead author Linda Bauld. Linda is a highly respected researcher in the field of tobacco control. She is a professor of health policy at the University of Stirling. She is the deputy director at the UK Centre for Tobacco and Alcohol Studies, and she's also a co-author of the Royal College of Physicians report, Nicotine Without Smoke. The study examined e-cigarette and tobacco use among 60,000 young people between the ages of 11 to 16 from across the UK. Data was gathered from 5 large-scale surveys conducted between 2015 and 2017. The study found that of the 60,000 young people surveyed, e-cigarette experimentation does not turn into regular e-cigarette use, and levels of regular e-cigarette use in young people who have never smoked remain very low, between 1/10 and 1/2%. Linda, picking up where we left off, we were discussing common methodological problems concerning vaping research as a whole, and specifically the challenges of measuring teen e-cigarette use. We zeroed in on 2 studies, one in Canada that claims youth vaping doubles the risk of youth smoking, and the other from the US that claims that youth vaping is a one-way bridge to youth smoking.
I find that a really unfortunate term. There are many things that make teenagers susceptible to trying a tobacco cigarette or becoming a regular smoker. The main ones, to be frank, we know from decades of research are whether their parents smoke, whether they live in a community with lots of smokers. So when we talk about the bridge, this is a body of research which is very limited. We need to also recognize that there might be a bridge out of smoking for kids who use these products. If they're already tobacco smokers. And let's keep in mind from our study and studies in the US in particular, the vast majority of teenagers who regularly use electronic cigarettes already smoke.
Linda, we hear all the time from regulators that the big danger of youth vaping is nicotine use. What do we know about this issue?
Researchers at the University of Michigan published a paper in tobacco control that showed, for example, amongst 12th graders, only 20% of them reported that they'd used an e-cigarette last time that contained nicotine. And another paper showed that around 1 in 4 products contain nicotine when you ask young people. I think we need to recognize that some of this experimentation, potentially a lot of this experimentation, is happening with products which don't contain nicotine. And if that's the case, then that underlines even more that some of the headlines are really unnecessarily alarmist.
Linda, what concerns you the most about the alarmist headlines?
My concern is that the headlines generated by these studies are used by regulators to really crack down on e-cigarettes in a way that actually might prevent access for adult smokers or also teenagers who smoke.
And Linda, isn't that the issue when it comes to regulation? The entire regulatory effort is predicated on protecting youth?
So to try and introduce regulations that limit the promise of new nicotine-containing devices for those adult smokers on the basis that we must protect kids, there's a real mismatch there. And we need to recognize prevention is a success story, including in Canada. We shouldn't take our eye off the ball, but we need to do much more to help adult smokers to quit. And we can't use concerns about the children as the main rationale for introducing restrictions which are not going to be helpful.
Linda, I'd like to get your perspective on regulatory developments here in Canada and in the US. Let's start first with Canada. As you know, Bill S-5 is quickly moving through Parliament, and the regulatory consultation process is also underway. There's also growing opposition to the legislation, and a general angst is building over the future of vaping in Canada.
So I think we should be open-minded about S-5. I know there's a lot of hatred and disappointment in the bill. And I know I'm not going to be popular by saying that we shouldn't be totally negative about S-5, but you know what, just to reflect for a moment. In Europe, in the UK, we have the European Tobacco Products Directive. We had a really poor piece of legislation in some ways, while other things in there were really good. But you know what, we've tried to make a success of that. The UK government took a light touch approach. We've tried to recognize the good things in the regulation and allow the products to still be available, to still have some forms of marketing. And now, of course, we've changed tack. We have a new consultation to allow health claims to be made clearly in the UK in the future, particularly by public health bodies, but also around the products generally. So hopefully this is what's going to happen in Canada. You've got a piece of legislation which might not be perfect, but I think it's better than what you had before in terms of the products are officially illegal. And let's see what success can be made of that.
Linda, as RegWatch reported earlier this month, Bill S-5 opponents believe the fatal flaw is that vaping is being shoehorned in alongside tobacco into the new Tobacco and Vaping Products Act.
Yeah, but the Canadian bill, I mean, I can see it's being put in with tobacco, but they're not calling e-cigarettes a tobacco product the way they are in the US. So that's an important distinction. You know, the Canadian legislation, it has lots of limitations to it, definitely. I'm particularly concerned about the limitations on manufacturers and retailers around the kinds of information they could give to consumers about the fact that these products are less risky than tobacco. It's absolutely crucial that that message gets across, and there are ways to communicate it. And I know the consultation is out now, and we certainly will be responding to it from the UK Centre for Tobacco and Alcohol Studies, a number of the large organisations that have been very vocal and pro-harm reduction in the UK will be responding to that consultation. So you can expect input from us.
I'm sure a lot of Canadian vapers take comfort in hearing that, Linda. But what about long-term input after the consultation process is over?
I know that Health Canada and their colleagues at the Canadian Institutes for Health Research have been looking at e-cigarettes for a while, and they're very keen to have good research in Canada. So my understanding is they're bringing together a group of experts to work with them over the next few years. And I've been invited to join that group. I'm really delighted. There are other colleagues from Canada primarily, but also the US, who are certainly very aware of the harm reduction agenda and are very positive about the promise of tobacco harm reduction, who will be invited to be on that group. There's a real possibility in Canada that you will see a positive attitude towards these products and recognizing the promise of them in the future. And I think officials are included in that. They've changed their view, they've been very open, they're continuing to try to be open, and they're listening to international experience.
Linda, public health officials in Canada may be hearing the harm reduction message, but when you read the federal legislation and how the province of Ontario describes vaping, it's hard to not come away with the belief that vaping is a health hazard.
Yeah, and I think that's really interesting. I think there's a lot of powerful voices still in Canada that are are using the what about the children argument to undermine the pro-harm reduction argument. And I think that's dangerous. I see it. I think we know who some of those individuals are, and they have very strong beliefs for whatever reason. And so that's influenced the kinds of questions that are being asked and the framing of the legislation. And of course, keep in mind that your average legislator in Canada, as in the UK, doesn't know this topic in depth, has read the newspapers just like everybody else, and is probably getting that message that these are dangerous products and we must protect the children. And that is not the primary thing, I think, from my perspective. So let's recognize that in my limited experience, there are definitely colleagues within Canadian government who get this. They know it's about supporting adult smokers to stop smoking by accessing a far, far, far less harmful product and being able to use that.
Linda, do you have a message for Canadian vapers on how to best survive the uncertainty around regulation?
What I would say to Canadian vapers is, I know this is a difficult time, and I know that what the Canadian government is doing now looks like something that could be very damaging to the products that you use, the businesses that sell them, and the route that Canada's taken over the last few years, where we certainly see people using e-cigarettes and they're hugely promising. What I would say is that I think attacking everything about Bill S-5 and regularly attacking all the legislators and people who are working on it is not helpful. We saw that in Europe. It achieved nothing, really very little. It's important to advocate and to do that in a measured way and to respond to the consultation and ask for the changes that you want. But aggressive attacking, particularly of individuals and other strategies like that, really didn't work for us. So let's stick to what we know, provide personal experience, which is hugely powerful, and get that message across, and just emphasize that lives can be saved by these products.
Poignant message, Linda, and one I'm certain could apply to our US vaping viewers as well.
I know people are very angry in the US. They don't trust government, they don't trust public agencies, because let's face it, what was on the table just a few months ago did look hugely damaging. But I think changes are afoot. They're being made now, and we have seen some very positive announcements. So vapers need to keep communicating with regulators and government, sharing their experience, and that includes particularly the small business people. But I think we need to recognize this shift and try and be a little bit more positive and not always be on the attack, because it's easy just to shut things down and not listen if everything you hear is negative.
Linda, last question. You referenced the policy shift underway in the U.S. Do you think the changes being brought in by new FDA Commissioner Gottlieb are mere tweaks, or are they transformational?
I think the U.S. is waking up to the fact that this is not a disaster, that the way they're classifying these products hasn't been helpful, that the deeming rule and the timing around that was going to be a total disaster, and they've backtracked. What you're seeing is a big putting the vehicle in reverse gear, and certainly pressing pause. So let's be pleased about that. They're listening to the international experience. They're recognizing that actually they have a huge problem still with smoking. It's killing hundreds of thousands of Americans every year. And they need to allow these less risky, far safer products to continue to be available. So I think the changes we've seen in the US over the last few months are positive, and we should try and be positive about them.
Well, that's it for this special edition of RegWatch. Before you head off, please like us on Facebook and don't forget to follow us on Twitter. For regulatorwatch.com, I'm Brent Stafford.